Today is a session that's focused on Medi Cal contracting and credentialing for the CHW benefit. And this can also apply not just for the CHW benefit, but for other Medi Cal services that would be more relevant or more accessible to your organization. And so I know we all know each other in the room. I think we've all met each other in previous meetings and sessions. So I'll skip introductions. I'll be facilitating today's meeting, and we will have my colleague Joanne. She'll be tracking notes and just tracking the conversation and jotting down people's questions. And so, if there's anything that we are unable to answer today, we can certainly get back to you after today's learning collaborative session. I'm going to skip this intro slide here. And I'm going to also skip this kind of overview. We're here, as we mentioned before, to provide capacity building for all the grantees at the LGBTQTA Center. Um, we have in the room three organizations, I believe, out of the seven that we are providing support to. So really appreciate those who have shown up to today's training. So the training agenda is going to be focused on two things. Medi-Cal provider enrollment through PAVE, a process in which all community-based organizations have to go through via the Department of Healthcare Services to become a Medi-Cal provider. And we're also going to take some time to review common components of a managed care plan, CHW Supervising Provider Readiness Assessment. So how does this training agenda sound to all of you? For Dr. Malachi, Amber, and Danny.
I just have a quick
Sounds
question. Oh,
sounds good.
Joe, will you have a chance for if folks have questions about their own applications to address those? Yeah. Okay, cool.
Yes, absolutely, absolutely. So if you have any questions, I know we are in contact or about to meet with some folks regarding their own kind of paid application that they are trying to submit, or maybe they have to correct their paid application due to a denial. There's also an MCP contracting process. I'm not sure if anyone is in the middle of MCP contracting or have gone through MCP contracting. I see you're shaking your head, Dr. Malachi. Amber and Danny, do you have any experience or have had any effort in the past done around MCP contracting or contracting with a managed care plan?
We have a contract for community supports, not for CHWs, but with Partnership Health Plan, we have a contract in place for community supports.
Oh, good to know. Okay, that's great to know.
And we're early in the exploration stage, so we haven't gone through any application process.
Got it. Got it. So that's good to know, Amber. For community supports, which areas of community supports are you contracted for?
We have day habilitation for one of our mental health drop-in centers, and then the housing tenancy and supports, the deposit, and then the housing navigation.
Got it. Okay. And that's with partnership
Yeah.
plan of California. And which counties?
Napa and Sonoma.
Napa and Sonoma. That makes sense. Okay, got it. Excuse me. And Danny, sounds like you're early stages but have not kind of pursued. Got it. And then Dr. Malachi, I believe your organization is the one who has tried to go through PAVE but not yet contracting, right? Okay, got it. Great. Okay, so we'll go through, and then so feel free to ask any questions throughout the course of this training. So we'll start with the PAVE enrollment and MCP contracting readiness and an overview of that. And we'll start with the PAVE overview and best practices. So PAVE is something that we really are learning a lot in terms of how providers can successfully enroll versus those who are unsuccessful. And there are just a lot of steps in order to achieve a, a provider status to be recognized under the state of California. And so um, before MCP contracting, it's important to enroll through the PAVE system, and we're going to go through some of the detailed steps that you have to enroll through the Department of Provider Enrollment Division and the Department of Healthcare Services. And I'm going to be showing in the future, in the next couple of slides, just more detailed information on how to sign up for PAVE, complete what you need to complete as an application, and what technical assistance and training documents are available. And after enrolling through PAVE, then you can initiate a contract with your local managed care plan. So some may know that California has 24 managed care plans that contract with DHCS to provide services to Medi Cal members. And in case you're interested in looking up your health plan, hopefully you can see my screen here when I go to this website, and I'll drop in the website in the chat box. This is a Medi Cal managed care health plan directory here. And so this is a really straightforward directory where, say, for example, if you type in Napa, say like Ambers County, you can see for, Ambers County, there are two health plans that you could potentially contract with, Kaiser Permanente and Partnership Health Plan of California. I know some of you serve in San Francisco. So if you type in San Francisco, click search, then you'll see more health plans that service the the San Francisco County area, and the Blue Cross, Kaiser Permanente, San Francisco Health Plan. And I'm sharing this because in order to contract with managed care plans, while PAVE is just one application that you can submit for the whole state of California, for MCPs, you have to submit a separate kind of application and go through a separate readiness assessment and separate credentialing and contracting process with each managed care plan. And each managed care plan has their own kind of set of rules and requirements. And so one thing that I usually recommend folks before they go to, before they start contracting with any managed care plan is to select a managed care plan where the majority of your patients or your clients or members are Medi Cal members of. So, for example, if you are servicing San Francisco County, if the majority of your patients and clients are receiving their Medi Cal insurance from San Francisco Health Plan, I would start at San Francisco Health Plan. You're more likely going to be able to serve Medi Cal members from San Francisco Health Plan and receive reimbursement of the services. But say you're contracted with Kaiser Permanente, but you're seeing a lot of Anthem or SF Health Plan folks, then unfortunately you can't bill, right, for those services. Is there another county that folks would like to share that they service? I know there's Napa, there's San Francisco. Any other counties that folks service?
Yeah, Sacramento, Yolo, El Dorado. I mean, yeah.
So Sacramento has several as well. There's Anthem, HealthNet, Kaiser, and Molina. I know Sacramento, Anthem, and HealthNet are pretty big. But again, every organization might be a little different in terms of their membership, their Medi-Cal membership. And so this would be a really great way to kind of assess. I don't want to throw like Kaiser Permanente under the bus, here. I know this is being recorded, but for Kaiser Permanente, their Medi-Cal membership tends to be a little smaller. They have very, I think, unique pathways in order to become a Medi-Cal member at Kaiser Permanente. And I know that Kaiser Permanente doesn't directly work with Medi-Cal providers for Medi-Cal services. they usually outsource to a consulting organization or a third-party organization to help manage that. And so Kaiser Permanente has kind of a unique process. And so I just want to call that out. Whereas Anthem and HealthNet, I think they have a direct kind of contracting process. Molina, if I can recall correctly, is a delegated health plan under I think it's under HealthNet, but I'll double check on that. So, and then so Sacramento, Dr. Malaka, you said YOLO. So YOLO is, KP and Partnership Health Plan of California. In this case, for YOLO, I think Partnership Health Plan of California will be your best bet here. And I know for a fact that they work really closely with and directly with Medi Cal providers and provide really great training and technical assistance. So that's something that you could research and look up. And for Amber, I'm curious, how has your experience been working with Partnership Health Plan of California as a community supports provider? Is there anything that you feel comfortable sharing with the folks on the line?
I mean, I think that what we found is that tenacity is key. They're trying to do a lot and they're trying to help for partnership. There's a lot of counties, there's a lot of us that are trying to get up and running. And so uh, they're not always the most responsive. And so we just kept asking and asking and asking and asking and asking. And so eventually we got what our needs met. It took us a while, but once you find people that are in the organization that then can help you get to where you need to go, that has been like what I've figured out has been most helpful. I've never asked for so much help on a project in my entire life. And so now it's just a part of like every conversation I have. And so then I'm like, great. Can you connect me to that person? So I feel like I did a lot of that, but we got there eventually.
That's great, Amber. That's a best practice. I love those three words. Tenacity is key. Um, and that's something that's pretty what we hear a lot from other providers. And when you work with a managed care plan, it's highly recommended to build those really close relationships, finding that right person in that department or division or a team of a large health plan. Health plans, there are a lot of folks who are highly experienced. They come from the direct service world. They understand operations of a clinic, of a community-based organization. And there's some health plans, and there's some folks in health plans who never had that experience. And so they don't really truly understand the spirit and philosophy of the work. And they're really there to serve as an administrator. And so finding the right person who can champion for you is going to be really critical. And that way they can, move mountains for you. So that's PAVE. And we also just talked about MCP contracting by the first step being identifying your health plan. And for the and then you can become a CHW supervising provider, or, for some who are interested, an enhanced care management provider or community supports provider through Cal AIM. And as we learned together in the last session, the CHW services include four main categories that we discussed. They're health education, health navigation, screening and assessment, and individual support and advocacy. Okay, how are we doing so far with this? Okay, great. So getting into a little bit more detail, and Amber, I know because you are a community services provider, your organization probably went through this already. You're probably already, a provider recognized in the PAVE system. So this is probably just going to be a refresh for you. Um, but for, I think, Dr. Malachi and Danny and others who are not yet a recognized Medi-Cal provider, these are the required documents for PAVE. And so I'm going to drop this into the chat box. There's a really great resource on the DHCS website And I'll scroll through the website in just a moment here. So if you click on that link that I just dropped in the chat box, you'll see the Medi Cal program requirements, and the required documents are detailed here in terms of what you need for your federal employer identification number, your or individual taxpayer identification number. What does your local business license entail? 501(c)(3) documentation, certificate of commercial liability insurance, or workers' comp, a signed lease agreement, and a successor liability with joint several liability agreement. So these are the 7 documents that are really critical and required for a complete PAVE application. And one thing that we like to emphasize is proving that you're a 501(c)(3) organization. We hear, funny enough, from the provider enrollment division who reviews the PAVE application that not a lot of CBOs submit a formal letter that proves that attests to their arrangement and status and proof of the 501(c)(3) status. So this letter must be on the sponsoring entity's letterhead, or just this is just a common, I think, one of the common denials or reasons for denial of the application. So proving that you're 501(c)(3) is really important here. The next resource that I want to provide is following this really important kind of slide deck that DHCS and PAVE has created. And so I'll drop it in the chat box here. This is the enrollment process for CDOs using PAVE. And so I'll open that up just to walk you through what you can expect. So this is, it's a fairly lengthy document. It's 42 slides, but you'll see screenshots in terms of step-by-step, how to confirm your information, selecting a provider type, selecting the languages that you offer through your services. And so this, I think, slide deck is going to be really helpful I will pull this up, when you pull up your PAVE application, and just make sure you're going through every section appropriately. And so for PAVE, there's going to be a lot of questions that ask about your business structure, your NPI number. If you don't have an NPI number, you can go to the National Plan and Provider Enumeration System website, which I'll link here in the chat box. Excuse me. And so the NPI number can be obtained for free through this CMS HHS Gov website. It only takes about 30 minutes to get so. And what you must obtain is what we call a Type 2 NPI number. This is the Type 2 NPI number is specific to counties and nonprofit corporations. Whereas Type 1 is for individual clinicians like MDs, NPs, LCSWs. They generally need an NPI number Type 1, but for organizations, it's NPI Type 2. And so this is needed before you set up your business profile on PAVE. And then once you complete, and for the NPI, I think I hear different kind of timelines, but I think for folks who complete the NPI application, the processing time can be up to 2 weeks. And so, but that varies depending on the volume of applications received. So that's something to keep a lookout for. But how are we doing so far? Are these 2 resources helpful? Hopefully these are informative. Okay, great. So those are the best documents, kind of best starting points. Your required set of documents, and then the deck that you should pull up when you're completing your PAVE application. I'm going to go into best practices for a PAVE application, and then we're going to move on to MCP contracting. So the number one thing that we try to promote is that your organization has to have at least one physical admin location in California to report on the PAVE application. I think there was an issue at one point where providers started signing up to be a provider, a Medi Cal provider, but not having a physical location. So this admin location is defined as a physical location that's associated with your provider's operations, where services are dispatched or based. And so, and they also may also occur solely in community settings, which do not have to be separately enrolled. And a community setting is defined as a location where people who are employed by or contracted with the provider who provide these services outside their administrative locations. So the admin location must be reported. It must not be a private residence, a virtual office, or mailbox, and may not be reported using a post office box. So we just want to emphasize that. You also want to ensure that you report at least one individual offering CHW services on the PAVE application. And so that's another common reason for denial when folks don't recognize immediately or when folks don't list down at least one person that is going to deliver the CHW services. For organizations that are just starting out or still figuring out their CHW services, it's totally fine for you to write down, who you think might, offer those CHW services as you prepare. Go ahead, Amber. I see your hand raised, and then I see Danny's chat as well. So, Amber, why don't you go first?
Yeah, I think we probably have a similar question. So first of all, just to know, partnership told me I did not have to have my PAVE application approved before we could start doing community supports. So I don't have my PAVE application approved. I don't know if that means they're not going to pay us or what, but we had that conversation with them, and because with partnership and because it's community supports and it's not, I don't know, technically Medi Cal, I guess you can have that contract without your PAVE application all the way through, supposedly. We'll see if I don't get my check. I'll let you know. But because I have not gotten paid for that contract yet because we just started. So that's just the first thing. And then the second thing is like I think I wrote this in an email, is like it seems backwards to have to do your application when you already have a certified community health worker. Like, why would we have certified community health workers if we're not able to bill Medi-Cal yet? And so I think Danny's question was similar to mine, is do they actually have to be certified or can they just be doing the work? And then my second question is, along these lines, is like, what if you're not going to start out with community health workers? What if you're going to start out with peer support services? But they don't ask about that anywhere. They only ask about CHWs. So I'm not sure where to put in the other positions, and then do they actually have to have their certification in order to get your application approved?
Yeah, no, really great questions, Amber. And Danny, I'm just recognizing your question. Does the CHW have to be certified or just providing CHW services that's defined? Um, so Amber, I think, well, I'll answer the second question that you asked, Amber, right? And that ties in with Danny's question. The CHW does not yet have to be certified at the time of application. When they see their first Medi-Cal beneficiary or a Medi-Cal member and provide services, it's within 18 months of that service date where the CHW has to have a certificate of completion. Um, there is no certification in the state of California. A certification is not required. Just a completion of a certificate of a training program is acceptable. And the training can be provided by anyone. It can be your own organization that provides the training. It could be a training entity like a community college or a university. It could be a training organization that maybe you partner with that's in California or anywhere across the country and even internationally. The requirements, though, you have to attest that your CHW workforce has completed the 11 core competencies in order to serve as a CHW. So when they provide when you're able to provide proof that your CHW has completed training in 11 core competencies so that they can deliver those 4 CHW services, then they're allowed to be CHWs under the CHW benefit. And so I hope that answers that question for Amber and Danny. Did I answer? Okay, great. And then Amber, good to know that I'm just recalling now that for Cal AIM, yeah, maybe the PAVE application is not required when you're uh, for when you're doing community supports, but I think it's only required in very specific circumstances, and it might be encouraged by some health plans, but not
Mm.
all health plans. So in this case, for Amber, your organization, since you did not go through PAVE, sounds like you would have to go through the PAVE application for sure, because I know for a fact that CPOs who are providing CHW services or asthma prevention services or justice involved services, in these cases, paid application was definitely required. But I'm just looking up in my guides here. I know there's some health plans like Anthem, for example,
Mm.
in their community supports provider guide, they call out directly that you must at least attempt to enroll as a Medi Cal provider through PAVE, but you're not necessarily required. So it's interesting. I think every health plan is going to have their own rules. So it sounds like partnership has made it easier and relieves that administrative burden by contracting directly for community supports.
Yeah,
Wait,
kind
yeah,
of. I mean, they went through their own certification process, right?
right,
So it
right.
might have been easier if they had just used PAVE, but they went through their own certification process. And then now, so I have to have Napa County come out and certify my site too. So we're gonna have all kinds of certifications here pretty soon.
Oh,
I
great.
never even know I needed.
Got it. Yeah, and I'm seeing in our community supports guide, yeah, things like housing navigation, tenancy, like recuperative care, typically does not require PAVE. So thanks for calling that out because I think we've been kind of sharing like the safest approach, right? Like just be a PAVE provider and then, or be go through PAVE and then go through a managed care plan. But it's good to know that some health plans still to this day do not require for specific things like community supports. So great. Okay, good call out. Other best practices, I appreciate this conversation and really great questions. Number 3 is ensuring you report all board members and all managing employees. So this is another common reason for denial um, because the provider enrollment division, they do audit. And so, and this is a struggle for some nonprofit organizations. I know for myself, I'm a board member of a nonprofit organization serving Asian immigrant populations all across the Bay Area. And when I encouraged my nonprofit organization to go through PAVE so they can become, a provider, they emailed me. They're like, "Hey, can you just email us your social security number and your date of birth?" And I was like, I'm like, let's jump on the phone and handle this more securely. And so that was my direct experience, just, forking over some really sensitive information. And for immigrant-led organizations, this can be a topic of sensitivity. You must also disclose ownership and control, things like whether anyone has 5% or more ownership or other control interests. If there's any adverse history, you must disclose any adverse actions, sanctions, convictions, etc. So there's a lot of information that PAVE asks for about its board members and managing employees. So something that's not explicitly called out in the application kind of training deck and the guides, but something that people often get surprised by. So I just want to give a heads up about this. Dr. Malachi, I know you went through this kind of PAVE process, anything that jumps out to you in terms of what your experience has been and anything you're comfortable sharing in terms of any surprises that you saw as you went through the PAVE application for your organization?
Yeah, I wouldn't say any surprises, but yes, it was a process of getting everybody's social security number. And I think what I'm learning in some of these trainings now too is it's choosing your pathway for different kinds of reimbursement. And I think this is so we have the community health workers, but we also do other services too. So I think where questions arose for me, and as I'm still going through this, is that of like, depending on what services we're doing, like making sure that our application is kind of the most robust to be able to cover all of those areas. But when we did this the first time, these parts, yeah, it was pretty straightforward. It took a little bit of time though to try to understand what some of these things meant. Um, Especially around the ownership piece, ownership and control as a nonprofit. Um, but these other things, yeah, it went pretty smoothly. But obviously, something happened. So even though it was smooth, we didn't do something right. So, yeah, but this is really helpful. I love how this is laid out. I copied and pasted all of the links too, so can help with redoing the application.
Great. Thanks for sharing your experience, Dr. Malachi. Yeah, it does take time. There's a lot of technical information and technical documents that are required. And so, for Amber and Danny, Dr. Malachi, if you ever need support as you're going through the application or, right before submission, you want to review your application, um, our team has developed a close relationship with the provider enrollment division at the Department of Healthcare Services. And so we can always kind of bring your, prior to submission, version of the application kind of send to them and be like, hey, is there anything missing? Like, can you please check for any errors? Could you please define what this means? And so that's a very kind of personal and direct way of receiving technical assistance. So we're happy to help liaise. We're always encouraging the provider enrollment division to, I know this is being recorded, but only shared with this group. We're always encouraging the division to provide some live technical assistance and ongoing office hours. We're not there yet. And so, in the meantime, we'll serve as that support, that kind of liaison for folks. Okay. So, let's go into MCP contract readiness. And this is pertaining to the CHW benefit. And so the common components that we see are these areas. And the areas in which MCPs will ask for a lot of information about your organization in terms of your mission, your vision, how long have you been around, who are your target populations or populations of focus? Do you serve youth? Do you serve pregnant people with chronic conditions? Obviously, LGBTQ populations of focus, older adults, people with disabilities. I mean, there's just so many different populations of focus that health plans are interested in serving, those who utilize emergency department room services. And then they're really interested in about your staffing and capacity, your current staffing capacity, future staffing capacity goals. So there's a lot of information that MCPs might want to know as a way to determine whether you are a qualified kind of provider who can support the MCP's goals in advancing health equity. And for them, it's kind of helping advance their metrics for their overall Medi-Cal population. They want to see an improvement in health outcomes in various areas. And so for your organization, given, Dr. Malachi, Danny, and Amber, your expertise as leaders, but for your organization, any kind of demonstration of your ability to provide services that result in the improvement of health outcomes for specific populations of focus will always be a great story to tell because that's what MCPs are held to in terms of their performance standards that the state kind of monitors very closely. So thinking of it as a win-win-win kind of like situation where, for the CBOs in this cohort, obviously you want to provide more services that are billable, reimbursable to continuously improve health outcomes for your populations. This is also in turn going to improve health outcomes for the Medi Cal member populations that MCPs are accountable for, and they're not. And as a state for DHCS, as a statewide system, they're going to be able to meet their larger kind of statewide goals of improving health outcomes. So it's just like a triple win across the entire ecosystem. The second area that MCPs are going to look out for is how your CHWs deliver health education and health navigation, screening and assessment, and individual support or advocacy. So, for example, let's start with which area do I want to start with? I think for screening and assessment, for example, does your organization use a standardized screening tool to screen for social needs, for example? Do you document these findings in your client records? Do you provide a copy to the member? Do you conduct a deeper assessment if needed? And how do you track ongoing needs over time? So sometimes MCP leaders will ask about that. In terms of health navigation, as you all know, Medi Cal rules are going to change come January 1st, right? And so we're going to see big drops in enrollment for Medi Cal. And with the 6-month redetermination kind of process, health plans are definitely keeping a really careful eye on how their providers can help enroll folks into Medi Cal. So health navigation, if you all are doing health navigation, where you are helping verify income and residency and documenting demographic information and enrolling folks into Medi-Cal, then definitely share with the MCP about your member eligibility verification process. So there are just a lot of things that you can share. Sometimes MCPs will ask for workflows. Sometimes MCPs will just ask for just like a 2-page SOP, standard operating procedure document on how you do these things. And in future sessions, we'll work together to help create these documents if you don't have these documents, or we can refine any existing documents that you have that you can bring to this learning collaborative session, and we can work on those together. So that way, after this learning collaborative finishes, you'll have all these beautiful documents that the MCPs might typically ask for. Even if they don't ask for it, you can still present it to them. And they'll have stronger faith and trust in you as a Medi-Cal provider. They're like, all right, we really got to partner with Open House because they have all these workflows and documents and really clear processes in place. The next area on this dark blue side, on the right-hand side, is something that health plans do care about how you refer and close the loop. And so whether it's in Medi-Cal enrollment or helping plan selection or provider navigation, how you go about addressing barriers like transportation, interpretation, or social determinants. This is something that providers or health plans are interested in, how you refer and outreach. And in terms of care plans, we all learned in the last session that CHWs, because of the standing recommendation, they can deliver up to 12 units, right, of CHW services. That's translates to 6 hours, but maximum of 2 hours per day, right? So 3 days straight, 2 hours max. Once you reach that 12 units, then you need a care plan that's written by a licensed provider. So whether that is in-house or a licensed provider that you partner with outside of your organization, you just need to be ready to provide those lists of healthcare professionals who are going to be involved and how you write those kind of objectives for care and the frequency and duration of services, things like that. And then lastly, data tracking and sharing and building. So, how does your organization track member engagement and service units? And how do you share data that's HIPAA compliant is something that MCPs will look for. A lot of folks think like they have to have some fancy data tracking system installed before contracting. I wouldn't recommend doing that until you talk to your managed care plan and ask specifically what their requirements are. I'm at one organization where they have one CHW, one billing person, one CEO, and one admin person. It's a team of four. This is a really small organization, and they're able to partner with a health plan where they just submit an Excel spreadsheet. They submit an Excel spreadsheet where the CHW just documents their service units, and they submit it through a portal. Every health plan has their own portal, provider portal, and they get reimbursed. That's really, really simple. I met another organization where they told me we invested $250,000 in a data tracking system. And it's no longer, it's just not financially sustainable for us. In my head, I'm like, well, I can see why it's not no longer financially sustainable. $250,000 is a lot of money. And so before you invest in anything big, always check to see, is this, what is absolutely required? What's going to help us meet compliance? And not only should data tracking just benefit CHW services, but how can this benefit our whole organization? How can we use this data to track our progress, to track improvement in health outcomes, to track engagement? How do we make data-informed decisions as an organization? Is this time for us to create some data governance? So this is a much bigger conversation. You're not just creating a data tracking system just for this service, but you're really this should be a really larger conversation on what kind of meaningful data that you want to track over time. One more story that I'll share is there's a lot of for-profit data tracking companies out there that's going to try to reach out to you and partner with you. Some of these companies are really good at selling their services. And so I'm not going to call them out loud, but anytime and I used to serve as an advisor for this one technology company because I was just really interested. I'm like, how do you really drive impact? Your mission says you're gonna help and empower your CHWs. Like, so my thing was like, are you really driving and empowering CHWs? And does your platform result in direct impact, right, for patients? And I learned very quickly over time that they're just in it for the money. And they'll sell a beautiful platform, but when it's not utilized, please name no shade. Just keep a lookout for if a technology vendor approaches you, I would talk to at least four others. Like try to talk to two or four others. Always seek go through an RFP process of your own, right? And just I would just ask about, upfront, like what's your initial kind of contracting costs? What's your user kind of costs, like per user per month costs? I would also ask what the data sharing agreement looks like, because these technology companies, they just want your data at the end of the day. And so some I say are more on the ethically better side, and some I know they'll market themselves as a very mission-oriented organization. But I know their investors think very differently. So technology companies, if you really need their help, if you really need them, just be patient. Date them for a long period of time and see if it's the right fit. If you can build your own system, your own kind of data tracking and reporting system, that's more sustainable and compliant with the health plan, then just go that route. Okay, I talked your ear off around that. Yes, Danny, that's a really great suggestion. Yeah. And always keep in mind, like these companies, I mean, it's kind of like the wild, wild west out there, y'all. Like once Cal AIM and CHW benefit rolled out, like all these for-profit tech companies just started spurring like out of the blue. It's like, oh, we can help you. We just helped this provider get reimbursed $10,000 a month. Or we help this a nonprofit recoup $300,000, da, 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 da. But there are some really unethical practices that we know that are happening, and so but the state is not yet kind of auditing and monitoring. So anyway, so it's just there's just a lot of just risk there. So definitely be mindful of that. So questions to ask yourself, when MCPs, they look for on this dark blue side, on the left-hand side, they want to understand like your claims and reporting processes, how you develop partnerships and workflows, and they want to really understand your model of care. And this is where you all are, all of your experts in your models of care. Document it, write it down, make it into like a pitch format. Demonstrate to your MCPs, not only are you seeking partnership, not only you may not only just be I wouldn't be in this mindset of just like, oh gosh, I need their partnership, right? Like you also have to be impressed by them as well, right? So make sure that all of your values aligned, your missions are aligned, ensure that there's that respect and value for one another. And on the green box on the side here, these are some questions for yourself, for your leadership and staff. Kind of just ask yourselves as you're, understanding what each MCP is looking for. Just think about, do you have to reconfigure your systems? How much will this cost? Do you have some referral sources of your own and that won't rely solely on MCPs for referrals? Do I have partnerships or an internal process to obtain the licensed provider sign off? And then also, what does my CHW program look like to continue or expand LGBTQ health and social care programming? And so just some thoughtful questions as you go through this process of contracting. Just a couple of last slides. I know in the interest of time, I'm going to just breeze through these last two slides. And sorry, I don't know why my let's see, I don't know why this is showing all weird. Okay, here we go. Is that better? The arrows are okay. So this is a really simple kind of kind of visual that shows your responsibilities, right, in terms of delivering the CHW services, doing the client referral triage coordination, overseeing your CHWs, training them and supervising them, and doing the billing and claim submission. Whereas for the managed care plans, it's important to just acknowledge that they're really responsible for just being in compliance with all the regulations that they have to abide to according to the state of California. And they're responsible for payment, right, for approved claims. And so this is a good visual for that direct reimbursement model. If you're going to go through a different model, like partnering with a tech company to do the billing for you, or partnering with a hub that's a nonprofit to help you with reporting and claims, there are different kind of models out there. And if you're interested in that, we can have more conversation around that. My number one recommendation is always try to do a direct reimbursement model, because once you get into direct contract, you start opening the doors for more contracts in the future, and you can tap into some of the health plans kind of quality incentive programs that do pop up, on an ad hoc basis. This is my last slide. So when you're contracting, just make sure you fully complete the form that MCPs are providing you, and provide any information about any applicable healthcare licensure, accreditation, or liability insurance, the attestation about your business or organization, or the oversight of your CHWs. Please obtain information about your workforce. I think sometimes some MCPs like to know upfront, like, who are your CHWs? What's their lived experience? What are their qualifications? Do they have a certificate already? What languages do they speak? And then this might be really simple, but also important to provide a W-9 taxpayer information form to allow payment of claims. So that's it. That's the Q and we've now reached kind of the Q&A session. But before everyone hops off, we'd love for you to please complete this survey. And so I'm gonna drop it in this chat box. So, oh, thank you, Joanne. Joanne's already on it. So Dr. Malachi, Danny, and Amber, if you can click on that survey and participate and just answering a few questions. We'd love to learn about your satisfaction level. How has your understanding of PAVE changed or MCP contracting? What was the most valuable piece of information? And are there any additional topics that you'd like to learn? And then while folks are filling that out, our next training is going to be focused on doing a deeper dive in those kind of requirement areas. And I know earlier Amber and Danny asked about training, right? Just training requirements. So we'll do a deeper dive in terms of CHW qualifications and training at the next session. And that concludes our training. I know we only have a minute left, but feel free to ask any questions if you're able to stay on longer. Dr. Malachi, I think you unmuted.
Yeah, I was just going to say thank you so much for this this space and this training. It's so applicable, so needed, and also the uh, considerate different kinds of considerations to hold when pursuing whether it's like data management pieces or making sure that we have all of our documentation together. It's very easy. So much appreciation. Thank you.
Thanks, Dr. Malachi.
I was just going to echo my thanks too. I have to jump off, but I feel like the fog is starting to clear a little bit. So I just thank you so much for like walking us through and sharing the resources. Like I feel in a much better place. So thank you.
Thanks, Danny. Okay. Amber, do you have any questions? Any thoughts to
I
share?
sent you an email with like 30 not 30, but I sent you an email with a long list of questions.
Good.
Great. I'm
So,
glad. We love questions and yeah, we're happy to look through it and we can hop on a call too
yeah, thank you.
to walk through those. Great. Okay. Well, I'll respect everyone's time. It's 10 a.m. and thank you so much for your participation and engagement. We'll be in
Thank
touch.
you.
Okay. All right. And I'll stop the recording.